Doctors are always discussing the latest diet. Are you confused? What diet do you choose? Break the cycle. How about eating nothing? Nothing. People are talking a lot these days about fasting, in part because fasting works. It's the most effective treatment for obesity and for reversing type 2 diabetes. The recent interest in fasting may be due to the work of Jason Fung, a Canadian physician who has been using fasting with his patients for years. He spread the word with these best-selling books. Dr. Fung and his partner, Megan Ramos, have successfully treated thousands with fasting. They are using both short fasts called intermittent fasting, which is generally less than 1 to 2 days, and occasionally longer fasts of days to weeks. But they find that these extended fasts are not necessary. They are able to basically cure obesity and reverse type 2 diabetes in a matter of weeks using the shorter fasts. They call their program Intensive Dietary Management, or IDM. I know what you're thinking. Why should I fast when I can just go keto? It sounds like torture and not the good kind. Well, studies do show benefits in mice. Longevity, anti-cancer, Parkinson's, Alzheimer's improvements. If you're wondering what this has to do with you, well, besides the effects on diabetes and obesity, many people report additional health benefits. From clinics all over the world going back decades, Canada, Germany, California, Russia, and many more. For weight loss, there's simply nothing like it. It forces the body to burn fat, but people use fasting for a variety of different reasons. Diabetes reversal, for blood pressure control, for arthritis relief, for headache relief, for bronchial asthma, to reverse fatty liver disease, to reduce risk of cancer relapse, for rejuvenation, for depression and other psychiatric conditions, for mental sharpness. It's even used as a brain hack by executives to give themselves a mental edge. But how does not eating cause so many wide-ranging health benefits? In the 2015 film, The Science of Fasting, the doctors call the process sanogenesis. Even after studying fasting for several years, the doctors in the film said they still didn't fully understand how fasting worked. What is our science telling us now about fasting? Well, we know that inside the body, young cells known as stem cells multiply. These stem cells are immature cells that multiply under the stress of fasting. They then gain access to the circulation and can help renew your tissues. There's also a cleaning process. There's a part called autophagy where the cells do their own internal housekeeping, cleaning up damaged cell parts. There's also a process called apoptosis, programmed cell death of older and sicker cells. Enhanced immune function, where there is more cleanup of precancerous cells. If fasting were a pill, with all of these benefits, we'd all be taking it. But we don't take action because fasting is hard and because fasting sucks. When I talk fasting with patients, they think I'm crazy, tinfoil hat crazy. Many of us won't even consider it because we feel faint if we don't eat by noon. There are so many false beliefs about fasting. It becomes our automatic defense. We say it will lower metabolism, but fasting makes metabolism go up. There are studies that show this. They'll be linked in the description. We say that we won't burn fat, that we'll burn our hard-earned muscle instead. This kind of makes no sense. The body has created a perfect storage system for energy, and then we would use, well, consider it like storing wood for winter and then chopping up the furniture to burn for firewood. Would the body be so dumb? We instinctually reject fasting because we know it's hard. It seems like a punishment. And haven't I suffered enough? I mean, look at me. I'm working out. I'm starving myself. I'm getting by on salads. And now this is my meal? A glass of water? Well, you know what I think about that. But eating less is not the same as eating nothing. There are totally different physiological responses. Eating less drops your metabolic rate, and it makes you cold. Anybody who's dieted knows that. We're always freezing. We're irritable and fatigued. This has been documented in countless research papers going back 100 years. In the Minnesota starvation experiment in the 1940s, they took 36 men and dieted them for several weeks on a calorie restriction of about 1,500. The men got really skinny, they became fatigued, irritable, and obsessed with food. Their metabolism dropped. But with fasting, the metabolism goes up, link in the description, and you have high energy after a few days. But it's hard to get started. In my first week-long fast, I felt like I was dying for the first 3 days, literally dying. But by day 4, I was full of energy. My brain was focused. I felt like I could cut glass with my brain waves. I had freedom from hunger, complete freedom. I felt like I'd be on the cover of Vogue in no time at all. I felt virtuous, like I would never eat again. I'd never previously been interested in fasting because usually if I skip a meal, I feel like I can't take another step. Overweight, stressed, and pre-diabetic, if I can fast, anyone can fast. There are secrets to success. Fasting is a skill, with techniques to make it easier, and ways to make it safe. Let's consider the longest recorded fast. 1965, Scotland. Angus Barbieri fasted for 382 days, over a year. He weighed 456 pounds when he started. He survived on coffee, tea, and water, and vitamins. And he was under his doctor's supervision. Angus lost 276 pounds, weighing in at 180 pounds at the end, and he stayed lean the rest of his life. Jimmy Moore, beloved low-carb blogger and best-selling low-carb author, recently caught my eye when he led a 7-day water fast. Jimmy Moore co-authored The Complete Guide to Fasting with Dr. Fung. Jimmy is an experienced faster, having completed 3-week fasts in the past. He invited his podcast and Instagram followers to join him, and they began July 5th, 2019. Jimmy supported them with good information, suggestions, countdown clocks, pep talks, and tactics. Congratulations to all who completed that 7-day challenge. 2,000 people began the 7-day fast with lots of great success stories, but only about 100 people finished the week with him, and that's with an expert leading the fast. The reasons seem obvious. Fasting is hard. So how do we make fasting easier? Over the years, different types of fasts have been invented to make things a little easier to get the benefit. So of course, juice fasts were invented, and the famous Master Cleanse, and recently something called the fasting mimicking diet. But these aren't really fasts, and it's not clear if they have all the same benefits. Fasts can be supported also by low-carb broths, like bone broths, and there are bone broth fasts, and also bouillon. Dr. Fung now recommends using bone broth to support the longer fasts of longer than 48 hours. Although it's not clear if it has all the same benefits, it definitely increases your chance of success. In Part 2, we'll take a deeper look at what happens in your body during a fast so we can fly over the obstacles.